Throughout this book, we have taken along some of the prominent psychological disorders to allow for a better understanding of how certain disorders, such as anxiety, depression, and schizophrenia, affect the individual and their patterns of thought. These conditions clearly do affect functioning on a daily basis for the people who suffer from them. In addition to examining the conditions, we have examined some of the approaches one can take to treating such disorders. Some of the approaches that are mentioned in popular culture, such as Freudian approaches to therapy, are not actually used in most therapist offices. When one receives treatment for most conditions, a therapist will use more rational approaches, such as cognitive behavioral therapy, that have been grounded in scientific research than what is commonly presented in television and movies. The armchairs and couches have been turned in for a more hands-on approach to treatment. The act of treating individuals and bettering their quality of life is truly hard work. The information that has been covered in this book provides an overview of some disorders and treatments. It is very important to remember that there is a great deal more to these conditions and treatments than what can simply be put together in a few brief pages. Research will contradict and conflict with other research when regarding the way the mind of an individual works due to the complexities of the workings of the human mind that has such an amazing design. I urge each and every reader to delve more into the studies of the mind for the purposes of both support and challenging existing research, my views and the views of all people who have come before me, so that we will have the opportunity to better understand the incredible way in which people think and behave. If we, as human beings, are fortunate enough, then one day we might just grasp enough of an understanding about psychological processes to truly realize how the mind fully works and the psychological problems that are very real for so many people who suffer from them daily.